Today I want to talk about facelift and neck lift. As you know, when we get old, our skin and the tissue under the skin get sagged or droopy. So we have to change this saggy skin and the tissue to fix our face or neck. What we do to fix our face and neck? The first one is the facelift. So during the facelift, we use incisions. We call it the preauricular, just in front of your ear, and another incision is just behind your ear. We call it the postauricular incision. We use these incisions to do your facelift and neck lift. Another incision we may use is just under your chin. We call it the submental incision. Why we use this incision? Sometimes with the patients who have very thick neck and overloaded just in this area, we need to use this submental incision, this incision to fix this part. So what we do during the facelift and neck lift procedures? The first one is when we make the first incision, the preauricular incision just in front of your ear, we elevate your skin and then we go under the tissue. We call this tissue CMAS. Around a line just comes from your lateral of your eye to your mandible. So in this line, we go deeper and elevate not only the skin and tissue too. We have to be very careful around this area because there are your facial nerves, facial arteries. There are a lot of very important anatomical parts. So the surgeon has to be very careful. And then we use the postauricular, the incision behind your ear. We use this incision and we will elevate your neck skin from this incision. After we elevate the skin, we try to remove the fat between your skin and the platysma. What is platysma? Platysma is a muscle around your neck. It covers your neck. So when you get old, the platysma muscle laxity changes. It becomes more loose. So we need to fix that part. How we fix this? Sometimes we use sutures like the threads to tighten that laxity. Sometimes we cut the muscle and we hang the muscle behind your ear to fix, like we create a hammock under your chin to fix that laxity. The facelift and neck lift together is a really long procedure. Like it takes like 6.5 hours. Patients have to know that it's not very innocent surgery because we do the surgery around your facial nerves, around your facial arteries. So after the surgery, you may have temporary nerve damages because we may damage your very superficial nerve parts. So after the surgery, it takes like 3 days to a week. You can have some numbness or you have problems to use your facial expressions, but these are mostly temporary. The other thing I want to tell you about facelift and neck lift is how long does this procedure last? For facelift and neck lift together, these procedures last at least 5 years. After 5 years, because of the gravity, your skin and tissue creates laxity again because there is a gravity and it pulls down your skin and tissue to ground. So it changes after the surgery. So we cannot stop this part, but we can fix it one more time.